All right, let's talk about breast lifts for a second. It's pretty common when I'm talking to somebody about breast augmentation, and I think there's at least a possibility we'll want to talk about a breast lift. I'll ask them before I do an exam. I'll say, hey, if I say the word breast lift, are you going to get mad at me? And not everybody, but most people give me a look that is some version of like, yeah, Pyle, I'm going to get mad at you. And I totally get it. Like, it's more surgery, it's more cost, it's more scars. But ultimately with this stuff, what we're after is a result, an endpoint. And very commonly we look at a lift as an evil thing, when in reality it's a super powerful, helpful thing. Like, if our goal is to, at the end, create something that makes somebody's life more comfortable, we ought not be afraid of a lift. We just have to decide whether or not it's the right thing. So let's spend just a second talking about when a lift is used and how you might know before coming in to see a surgeon if it's the right thing for you or not. I think the internet talks about lifts only in reference to the position of the nipple. And they kind of say, like, if the nipple's in the front of the breast, it's probably fine. If the nipple's towards the bottom of the breast, you might need a lift. But like most things in life, it's more complex than that. And there's more than one reason to do a lift. Sometimes the reason that we're doing a lift has very little to do with the nipple position. Sometimes it just has to do with the distribution of the breast tissue. So somebody may have a very heavy lower breast and very little in the upper part of the breast. They may want a smaller implant. And to match those things up sometimes requires removing some of that tissue at the bottom of the breast so that there's balance between the upper and the lower parts of the breast without a really big implant. So sometimes we're using a lift to create better balance between the top half and the bottom half of the breast. Sometimes we're using a lift because the nipple isn't in the position that we'd want it to be, in the center of the breast when we're done. Not necessarily the center of the breast when we're starting, but the projected center of the breast when we're done. And then a third example for when a breast lift is helpful or is needed is when the skin doesn't match the size of the implant that we want. That's why I say, like, lifts aren't evil. Very commonly the only tool that allows the person to end up having the thing that they want. For example, if a person's breast got way stretched during childbirth, and then they have the child and the breasts are still really stretched, but they're not full anymore. That skin that's there either needs to be filled up with an implant if a person wants an implant, either needs to be filled up with an implant that's big enough to fill the skin, or the person picks the implant that matches their frame, that matches their goals, that matches what they want the appearance of their breast to be when they're done, and then we tighten the skin to match the implant that's beneath it. So how do you know if you need all these things? Honestly, the first one and the third one are hard. You know, like, whether or not you need one for bottom heavy breasts or loose skin, that is a pretty complex discussion with a surgeon. There is no at-home test to know if you need a lift. As for the nipple position, if it's below the bottom half of the breast when your arm's at rest at your side, below like the center line, it's pretty likely that you'll want it or need it. And the easiest trick that I know to know if you want one or you don't want one, again, it's not need or don't need. No one needs a lift. It's want or don't want. To know if you want or don't want a lift is to stand in front of the mirror with your arms at your side, put one arm down to the side and the other arm way up towards the ceiling. And when you do that, if you look at your two breasts and you look at the one with the arm up and it's way more in line with what you want your breast to look like before you put an implant behind it or without an implant behind it, then you want a lift, most likely. If you prefer the look of your arm down breast with or without an implant, then you probably don't want a lift. That's it. But, like, I guess if there's a message behind all of this, it's that we probably ought to reframe as surgeons, as patients, how we view a lift, because it really does come down to want. Also, there are some things that I know when a person sits down that they want a lift. Sometimes people will sit down and they'll be like, Pyle, I don't want to lift. I just want the implant to lift my breast. And I'm like, you heard it, right? you heard the word. It's in there. So if you find yourself like secretly kind of knowing that, like doing this with your breast or this with your arm or like pushing your breast up to show you what you want, you might want to lift. Hope this helps.